more consistently.
Yes.
Because the more precise we can be, the more consistency we can produce.
Certainly. I mean, in the field of psychiatry, if we look, for example, I mean, at a prototype disorder like depression, for example, it's very common. About 40 to 60% of people that experience depression are going to have relief from psychotherapy and prescription medication. But if you look at that statistic, the exact inverse is true. 40 to 60% will not. So there's a persistent unmet need in that field for disorders like anxiety and depression. There's a lot of people that don't get better with your frontline therapies. If you look at concussion, for example, and this is where these two fields have intersected for me, because I spent a lot of my career dealing with brain and brain injury. In concussion, for example, about 15% of people with concussion are going to have persistent symptoms afterwards. 40% of them are going to end up with depression and or anxiety after a concussion. So if you take that 15% and the 40%, it means that very many of the people that with the 15% that end up with these persistent symptoms after concussion that don't resolve end up with persistent anxiety, depression, these vague kind of symptoms and emotional problems after these concussions. Now, in a sport like you and I had the privilege of attending to a world-class athlete here recently. I don't want to say his name, but here recently, just this past weekend, and this is a surfer who's had multiple instances in his career, which is very typical, where you can remember getting his bell rung. Well, each time you get your bell rung, there's that 15% chance that you're going to end up with persistent symptoms. So it's just like, don't roll a number 6 on a dice. Each time you roll that dice, you got a bigger chance of hitting that 6. And for a lot of people, that means that there's a huge population of people in contact sports like surfing and these types of things, where they end up with these persistent symptoms that they kind of write off or accept as normal. And a lot of time that's in the behavioral domain: depression, anxiety, panic attacks, insomnia, emotional dysregulation, these types of things.